Hi everyone, I'm Dr. Myrdalis Diaz Ramirez, creator of the Max Salud Mastermind, which is a physician entrepreneur mastermind. Today we have our Fridays of the Max Salud week, as we call them. And I want to dedicate this episode today to Dr. Stephanie Houston and Dr. Preston Phillips, who unfortunately passed away this week in Tulsa, victims of unfortunate violence. Actually, Dr. Preston Phillips and I shared the love of medicine, our patients, and we didn't know this, but we also share a very special friend that we have in common, Dr. Miranda Phillips, and she has her, both of their last names are the same. So hugs to you, Miranda. I know that you've been very hurt by this as well as we all are. I want to tell you about our Max Salud week. We're very excited about this week. On Monday, we introduced our topic of the week, which was the new product development for physician entrepreneurs. On Tuesday, we had our podcast with Dr. Hanei Tokita. She's an anesthesiologist like I am, and she's the creator of GAMS, a compression stocking. I have this here, and then we're going to be opening it together. I haven't opened them yet, so that I was waiting for you to be here so we could open them together. On Wednesday, we had our call to action where we gave you some specific tips to start your new business idea, and you can go and directly and start working on that if you have any business ideas. On Thursday, we reflected on having a new business and idea, and as Thomas Edison would say, good fortune is when opportunity meets planning, and that's what we want to get you through today. We're going to go over the different steps of developing an idea. And before that, we're going to go, and we have a special gift for you guys since you're here, courtesy of GAMS. We have a discount code when we're opening this from Dr. Tokita. Unfortunately, she's not here today with us because she is in the OR taking care of patients. But things that she had and we review in our podcast, I invite you, by the way, to listen to our podcast, Design Your Physician Life, where she talks to us about her adventure in designing these compression stockings. We know that she was obsessed. She used these words in her in our podcast. She was passionate, excited, and she loved that she would be uplifting women with her product. And you cannot have you can have a business, but something that's going to be successful, you have to be passionate about. And the word that she used was the word transformative. That was really a word that she was looking. She was very excited about that word in having a transformative business for the clients that she has. And in her passion, she had an idea, and she got together with her partner who shared the same passion. Then they got just to work. And once they had the idea, they developed it, and they started cold calling manufacturing places. They had rejections, but they had conviction. And they went ahead and until they were able to finally get somebody who took on her idea. They gave her a prototype, and then eventually they were able to manufacture this product for her. And she sends this from her house. Still to this day. She talked about something very important when we're developing a product, which is knowing your limits. Right now, there's a supply chain limit in many areas, and she talked to us about how to grow. That's something like is very important that we go slowly. If you know where you're gonna go, because you're not only gonna have problems maybe with supply chain. It might be that you don't have the employees or you don't have the funds to be able to engage into a big enterprise. But that's where planning comes into action, right? Planning is going to be a very important part of any product development if you really want to be successful. So despite her her struggles, she was still resilient. She says that she was cool, collected, and in anesthesiology we have to be like that. Like if we have a patient who's in danger, we have plan A, plan B, plan C, and you cannot just be all razzled because something bad could happen. You have to really be cool, collected, so that you can think and you can process, and then you can take your plans into action, which is what she did. One thing that she learned a lot during this whole process was time management. That's one of the things that we teach in our Physician Entrepreneur Mastermind. That's something that we all struggle with. And time management has to do a lot with what our priorities are. We have to treat ourselves, our lives, the same way like we treat projects in a similar way, where we say, what's our mission and vision for our lives, for our principles, and then we go and do time boxing according to that, and then that's how we get to time management. But obviously we sometimes need a little bit more training than that. So right now, what I want to do with you guys, and I see that we have some people here hashtagging live. If you can please hashtag live and hashtag replay, we would really appreciate. And if you can later visit our website, maxsalure.com, you can get more information about our mastermind. We're hoping to have our next session starting in August. And we have our podcast, Design Your Physician Life, where we have lessons for everybody. So let's go and open GAMs. This is the first time I'm opening them. And she wanted to do some compression stockings because the truth is that a secret to young legs is compression stockings, especially if you're standing up all day long, if you're sitting down all day long, whatever you're doing, these are really, really good. And there's different types of compression stockings. In this case, she decided to do them for women. Feminine, you have men and women stockings. You have some that are unisex, and they also have different pressures. So in this case, these are 15 to 20 millimeters of mercury. And then why am I going through this whole thing with this opening this product? Because you can do it too. I'm not, we're going to be hopefully becoming good fans of GAMs, but let's talk about the process. This was in her head. She was there sitting in the OR thinking, oh my goodness, I love compression stockings, but I would like to solve this problem that I have, which I want them to look more like this. She found a partner, she went through the process, and here they are in our hands. So let's go. So if you see, packaging is also part of the process, and even every little ridge, everything that she has, branding that she has. We love GAMs, we love legs, right? All of that is part of that process when you're designing your product. The other thing is that in this case, they come in different sizes. We receive small, medium, large, and extra large. We're going to open a medium here. So we go through that, and then hopefully we have a good experience opening this package. So we have, and then I haven't had any problems so far opening this. And she thought, so she gave us a message here. So let's read the message here, which is #leglove. So thank you, Dr. Tokita. And it says, hello, friend. We can't wait for you to try these everyday compression socks. It's like giving your legs a gentle hug. Our brand of hugs will fight fatigue, reduce swelling, and can even help prevent those pesky spider veins. And I have to tell you that that's true. It's true because that's what we use all the time. That's our secret. When you see us in the OR, in the hospital, in our medical offices, most of us are wearing compression stockings. Talk to any vascular surgeon, women, male, doesn't matter, they're wearing compression stockings. So she continues to say, wear your socks daily and you'll be ready to take on the world in no time. You've got this. So that's one side. On the other side, she says, take care of your socks and your socks will take care of you. So she gives us some care instructions and she tells us how to do that here. So all of these things were in Dr. Tokita's head not that long ago. And then she designed the packaging, the love, and the stocking. And then in terms of the quality, I've had other stockings and I have to tell you that these feel really pretty sturdy. I'm not going to try them on right now. That's not the purpose of these. I just want you to think about the process. But in terms of the process, you have to think certainly of your client. So if I'm the client that I'm going to buy these so far, this is part of what I would like to see. So it has things there, messages for me that I'm going to feel special about my purchase. It has easy to use, easy to see the sizing. It says the purpose. It has, it's important that we, in compression stockings, for example, that we have that measurement there because some people cannot use compression stockings because of high blood pressure problems or things like that. So everything's well thought of, including the care of the stocking. So because you've been here and you've seen our, unpacking of the stockings, we're going to give you a special code. I hope that you guys can write it down. So it's going to be leg love BOGO. So that's LEGLOVE BOGO. That means leg love, buy one get one. And that's for the first 50 people who use that code. She's gonna then give you an extra pair of stockings for free in her website. And the legs, the compression stockings are called GAMS, GAMS. So that's her experience. I'm glad that she sent us this for us to try. So far, I'm loving it. I'm gonna try them on and give her some feedback, but it feels actually like very good quality. And one of the things that she talked about is that when she was thinking about this particular project, she thought about pricing. And pricing, she was looking for something that wasn't as expensive. She saw some $40 stockings. Hers are much less expensive, and now you can get 2 for 1. So when we're solving these problems, we solve them because something has impacted our lives, and that's how we get into some product production. So when you're thinking about a product, you have to get close to where the knowledge is, right? In her case, it's going to be a product that's going to be a combination of fashion and healthcare type of thing. So you look for those societies. We have, for example, I belong to the North American Neuromodulation Society, where we deal with spinal cord stimulation, right? That's for me in pain management, but stimulation is used for many things. It's used for the brain, for the heart. That's where pacemakers come from, that neuromodulation. So North American Neuromodulation Society. So if you want to create a product that's going to be affecting patients in that way, where you can maybe create some new set of leads that could go inside a patient's body or a machine, then you associate with that type of society, and then you attend those meetings, and that's where you make relations. So it's very important to connect with like-minded people, and then that way you can learn the processes and the internal struggles and the external successes they've had in many different cases. There's other, if you want to create a medication, then you can go maybe to the International Society for Pharmaceutical Engineering, and then there you connect. For those who are not in the medical field with their products, you can go, if something about clothing, for example, you can go to the Textile Society of America, and you go to those meetings, and that's where you do your relations and building your product. There's one important one which is called the Product Development and Management Association, PDMA, and you can look that one up. So first, passion, planning, getting to the right people, getting to the right societies, right? Where you have to connect, and eventually they'll help you to develop your product. If you don't have any of these things, you have just to look them up, right, and start asking. I want to take you through the 7, depending on who you talk to, there might be 7, 10, 13 different steps, but I'm just going to give you 7 steps of new product development process. The first one we're going to talk about is basically the idea generation, right? And that's what we talked about in Dr. Tokita's case. She had an idea, and she had brainstorming, and she had different iterations of the same product. At the end, you might think that, it's very doubtful that you start with exactly what you end up, especially when you go to the manufacturing area. They're going to tell you, this can be done, this cannot be done, unless you've had some experience already in that area. And then you do the brainstorming. That's usually done in groups many times, where you guys combine and have the new ideas. Doing the research would be our second step, where you get feedback from a substantial audience, either biased or unbiased, for product validations. Like you go for your potential client, right? You have to know your client, and then you have to make sure that you're solving a problem, because I might be wanting to solve a problem for me, but maybe not many people have that problem. So you have to really find your niche, your market, making sure that your plans are going to be targeting that population, and then validate. Also, besides validating what you're going to be doing with the market, validating what the product will be looking like. 3, planning. That's like through and through, right? So bring the product to life through sketching and illustration. So you're going to be sketching what it looks like. If you want to do patents, the U.S. Patent Office has a very easy tool online. You can go and you can look up for similar products, and you can see how they sketch their prototypes and everything there, and what they finally submit, so that you can get an idea. Eventually, it's recommended that you get a lawyer if you're going to really get patents, and there's different types of patents. This is not the the purpose of this little talk here to discuss that. But it's very important that if that's what you're looking for, that you think about how it's done, and it's very easy to access. If you have access to go to Washington DC, they have the office there, and I've been there, and they have actually they have wonderful help there. You get this pass, it looks like you look very official government style, and then you get help to look for other similar patents. A lot of that research can be done remotely, but it's certainly part of the planning. That's step 3. So step 4, then once you've done you have your idea, you've done your research, you have your planning, then you go to prototyping. And prototyping is very important because it's gonna give you an idea of how the cost and everything's gonna be looking like, how the product is gonna be at the end, and it's gonna be creating from that sample. That's called the prototype, the sample for the mass production. And it's important that you don't just say, oh, I'm going to send my designs and have them done somewhere else without you really understanding how those places work, what the work ethics are, what the timing, what the experience of other people are working with them, and what your product would look like. And you have to prepare for the timing that all that takes to happen. So if you can get somebody who's going to produce your product closer to you, that might mean a higher expense, but it might mean that you have a product where you have more control. We know that many people go to China, for example, and they have wonderful factories there, but you have to really know the language, make sure that you're going to get what you're paying for, that you're going to get things on timely matter, what the taxes and transportation. It doesn't have to be China, it can be like any other place in the world. Just a big example. In this case, Dr. Tokita has her GAMs made here in the US, and she was able to find somebody here in North Carolina, as I understand. So then after you go through your prototyping, then you have your sourcing. So you have to get the materials, gather them, and secure them for your partner, right? Because you might have, well, they might do everything for you. They might have everything, all the services where they gather the materials for you, but that's part where you also want to be involved, because you want to make sure that the quality that you get from your product is what you've promised yourself and what's your promise other that you're gonna get. Then costing is our 6th step, the total cost of goods sold, to determine the retail price and the gross margin. And at the end of the day, it's a business, right? Like, you don't want to lose money. It's going to be an investment that you're going to be making, but hopefully you've planned long enough and ahead of time, and with all these steps taken into account, that you're going to be having a successful business. And then after that, we get, like, you had your idea, you had the planning, you made the prototype, you're ready to commercialize. That's our last step. So that's when you launch the product into the market. And that itself has a whole lot of other steps, right? When you're doing marketing, you have to determine how you're going to do that. For example, in some people will go just like for the local stores, and then eventually getting into the larger stores, the retail stores. We had COVID happen when Dr. Tokita was looking for, opening her brand to the world. And what she decided to do was just to do an online store. And then you can decide to do your online store. You can decide to go through Amazon, and all those things are going to have different costs, different people who are going to get to you. And it's going to be different in the time, in the amount, in the length of time that is growing, right? You're going to need to have so many stockings from your house to send via a mail from your house. Maybe you can do drop shipping if you find a drop shipper who will produce your product and then send it from them. Then they can store more. Or then you can have, if you're going to have a larger ask of product, then you have to really plan how you're going to purchase all that amount of product and how you're going to sell it along with your distribution channels. So I hope this has been useful. I know that some people are here that you guys have commented about products and community. I don't know if you have any comments right now before I go. I do want to thank you again. I'm going to repeat again the code. So if in case you want to get some compression stockings, I have to tell you I'm touching them and it's impressive. They're really sturdy. The code is LEGLOVEBOGO, LEGLOVEBOGO. So buy one get one. The first 50 people are going to get one free when they buy one from GAMS, GAMS. I want to thank you all for being here. Remember to visit our website, maxallure, maxallure.com, and follow us on LinkedIn, on Facebook, on Twitter, and see our weeks. So next week I'll tell you what we are doing on Monday. This has been all about creating products. That's one of the passions that many of our physician entrepreneurs have. And don't forget to listen and share our podcast, Design Your Physician Life. So thank you for being here with us. You can send us a message and tell me if you want to learn about anything else, and I'll do the research and get somebody to talk to us about that. So have a great time. Have a great weekend. Hugs to you all. Bye.